All right, without further ado, normally I wait a little bit longer, but I know this can actually get long and jam-packed, so I want to make sure that we have enough time to get it through everything. So I'm Jonathan Miller. I'm a partner at the Bonadio Group in the advisory service line, and I'd like to thank you for joining us for this session and all the other sessions that we are hosting this week as part of our annual tax-exempt webinar series. So some information about this session is the presentation materials and the links to the webinar replay will be sent to your email within 2 weeks. And if you haven't registered for any of the remaining sessions, you can still do that, as I believe there are a few more, and the link will be provided in the chat. And also today, I am joined this afternoon by Gabriel Overfield, or I call him Gabe. And Gabe is a experienced healthcare attorney with Bond, Schroning and King. He is located out of their New York City office. He is also a member with them, but prior to coming to Bond, Schroning and King, he worked at various provider groups and agencies and advocating for them in the healthcare arena, as well as assisting them with developing the BBP. I met Gabe probably about a little bit more than 2 years ago on a mutual client, and we've kind of worked together and had a very good working relationship ever since. So even with this waiver, we kind of bounce items back and forth with each other. And some of you attended our November session as well. So we co-presented there as well. So that was on his platform. So I returned the favor to invite him here to speak. Couple of housekeeping items. Make sure you can see the content. My screen is being shared, and I know some folks can see it, but make sure you can see it. Make sure your speakers are on and your earphones are on as well. And to adjust your audio, it's at the top of your settings and then devices. And then for questions, please put those into the chat. We do monitor the chat throughout. As Gabe and I go back and forth, we'll be able to see it. And then for those for needing CPE, and I know you've been attending, most of you have attended earlier this week, and you know how to use it. But please use the conferences IO button. It's at the top of your screen. If the button is not available, scan the QR codes that you're going to get on each of the polling questions. Complete the check-in form, and when the poll is open, it automatically goes to your screen, and then click the response or what you believe to be the best response, and at the end you check out, or if you leave at the end of the session, or if you leave early. And then disclaimers. I do think it's important, especially what we're talking about as it relates to the Medicaid waiver program. This is for educational and informational purposes, and this presentation is based on what we interpret what the laws and the laws and the regulations are. And the statements and opinions, those are our opinions. They do not represent the Bonadio Group or Bond, Schroning and King either. And just note that we are recording this. As we mentioned, we'll distribute. But we are recording it, so we want you to be aware of it as well. So a lot there. We're going to jump right into the polling question. And as you can see it here, how familiar are you with the objectives of the 1115 waiver? Obviously very familiar, somewhat familiar, or not familiar at all. So please take a moment to answer that, because that kind of level sets. One of the items that Gabe and I talked about, and I mentioned earlier, is we co-presented in November, and I would say that time we did what I would call maybe like a 300 level. But what we focused on at that time was the capacity building, what the strategic capacity building was at that time. And we kind of looked at the questions in the chat, what people were saying as we were talking, and they wanted to know more about the waiver. And then we kind of took a step back. And even last week, or Gabe and I talked about last week, is we presented on this topic to other various groups, and also we meet with our clients and other various organizations. And sometimes what we get is some of the questions we get maybe are a little bit surprising. So we kind of said, let's take a step back. We're not going all the way back to 101, but we are going maybe what I'd say that 102, that 201. If you're a human service, a CBO organization, a nonprofit, you're saying, how can I participate? I will always reiterate, contact your social care network. They are out there doing great advocacy, getting the materials out there. Here's just one mechanism to learn about it. So objectives of what we want to accomplish today. So obviously, one, we want everyone to be able to leave here and say, I understand what the waiver is. I understand what the social care network is. I know new acronyms such as SCN and social care network, HRSN, health related social needs. If you get anything from it, at least know some new acronyms. but then start thinking about how your organization can participate in this waiver. And if there's opportunities for you, how you can build up capacity and what those strategic considerations are as well. And then ultimately lead it to say, this is what we should consider, and this is the path to our participation in this waiver. So what is this waiver? I keep saying waiver, waiver, waiver over again. So it is called the 1115 New York State Health and Equity Reform, HER waiver, sometimes how you refer it. But for this this waiver, we're hearing it just more the 1115. And I think it's important to understand a little bit, what do we mean when you hear someone say 1115 waiver? Because you're going to hear it a lot. So what a waiver is federal CMS, Centers for Medicare and Medicaid Services, is what they're doing is they're waiving certain regulations they have related to the Medicaid program because they want to see research and development. They want to see things and practices tried. They want to understand what works and what doesn't work. New York State, the district program that many of you are familiar with, was an 1115 waiver program. So district was it, and we're building off those practices. But other states, California, Texas, Oregon, Massachusetts, Maryland, they all have waiver programs too, North Carolina. So a little bit of this waiver sometimes filled in from what they've successfully done there, but we're also trying some brand new things as well that maybe another state's waiver program will build on. So that's what we mean when you hear waiver. So if I was in person and had a little bit more interaction, what I would say is, what's the most important thing on this slide? And a lot of people, they'll say, well, the most important thing is the $7.5 million or the $6 billion that was approved last January. What I point to is the waiver is in effect to March 31st, 2027. So we are almost in February 2025. So we have 25 months to do everything we're going to lay out today and then some as we go through the strategic considerations. That to me is the most important item on this slide. The other thing I'll say too is as we go through this presentation, Gabe and myself, is you'll see these slides, a lot of these slides are pulled from New York State, publicly available. We credit where they're taking from. It's really, when you look at these slides, there's no need to recreate the wheel. To me, they're very good. And we only pulled a sample of what we thought was important for this presentation, but you can go to where we credit, in this case, in this case, it's Mayor Becerri. You'll see other DOH slides. You'll see meeting minutes. I encourage you, if you really want to learn more about it, to take those credits, put them in your Google search, and it will bring you to it. And you can see a wealth of more information. And then lastly, before I turn this over to Gabe to get a little bit more in the details, is really this waiver. And a lot of people, especially within these groups, talk about the social care networks because that's what's been getting the most press. But this waiver is, it's cliche. It's a three-legged stool. Part of it is we got to focus on population health. And we've seen that through a global budget program for downstate hospitals. We're seeing it through primary care models and the AHEAD model. But none of this waiver will work, no matter what we want to do with anything, will not work if we don't have population health. The other part is strengthening the workforce. The waiver has allocated money to strengthen the workforce, and they've done that through the Careers Pathways training programs. There's 3 workforce investment organizations across New York State to really work with individuals to train them in the health and social field. So again, this waiver doesn't work unless we have people able to actually work and do the work. Then lastly, what we're going to focus on a lot of today is the social care networks as well. And this is the theory, this is based on the theory of providing social care, that an individual, and where we are in this country and really this world with healthcare, that really individually, are we treating what I would call, are we providing sick care? Are we treating what is a symptom to the problem? And is the problem really sitting with their social care needs, their health, nutrition, transportation, and a host of other things? Those aren't being taken care of, and that's why they're ending up in our emergency rooms with double to triple pre-existing conditions. So that's really when we say social care network, what we're treating. So with that, I'll take a breath and turn it over to Gabe to walk through a few slides.
Well, thank you so much, John, and really first appreciate the warm welcome to me personally and to our firm. We're grateful for the working partnership with you on the work around the 1115 waiver and in other domains as well. And let me also say thank you to all of you who have tuned in to this next iteration of the Bonadio series. We're hopeful that already it's been instructive, and that as we move through the balance of this hour, you'll find that this information we're sharing with you is ultimately worth your while. We very much, of course, believe it will be. And we at Bond have been working on issues surrounding waiver programs for quite a while. It goes back not only to DSRIP, the Delivery System Reform Incentive Payment Program that John alluded to, which ran, generally from 2015 to 2020, and indeed we probably worked with some of you on the line. But Bond's involvement in the various forms of alternative payment mechanisms and experimentation within the Medicaid program. We have longstanding experience and roots there, and so we bring that to conversations like this, and truly with a passion around the work. As John mentioned, in my background, not only am I with Bond as a member presently, but before that I was a trade association executive for about 8 years and worked as well in New York City government on issues very much aligned with what we're talking about today. So I come to this, with a personal passion, wanting to really see this work, and we want to help you be participants in it from various perspectives and modalities. And we think that you can do it. We want to just give you a little bit of additional guidance, and as John said at the top, that's really the goal for today. So let me talk about social care networks. Essentially, they are key organizers in this current iteration of the 1115 waiver amendment. The way that it's important to think about these funds, as John said, they come through CMS. They are intended for experimentation for that 25-month period. The money, officially comes through the Department of Health up top, and John will get into this later, and then ultimately through managed care organizations, and then to the social care networks. Just hold that thought for a moment. But the social care networks are really intended in 9 different geographies, which we'll show you in just a moment, to organize what it is to deliver these health-related social needs type services that the waiver allows for New York to undertake through essentially what will be paid for services, compensated for services in this grand experiment. And so on the slide in front of you, you see reference to various different entities that are going to be working together, if all goes well, in order to see this iteration of waiver funding be successful. And so you see in the blue circle a bunch of CBOs described, as well as an SCN lead. We'll talk about that more concretely in a moment. In the purple, you see an IPA and a FQHC, et cetera. Really the point around this is that it will take that proverbial village for this work to really be successful. And SCNs are serving in many respects as regional quarterbacks. And we'll get into the details of that in a moment. But one of the things that you'll see again at the bottom of this slide is reference to establishment of technology platforms, for instance, working on eligibility for level 2 services. We'll talk about that more concretely in a moment, but those, in short, are essentially the services that are going to be paid for through the waiver money, and to do other work around kind of making this idea actually happen. And that work has already begun, I should be clear. The money was allocated back in January of 2024, or I should say approved by CMS at that point. And there's been a significant amount of work through the balance of 2024 into early 25 to get money actually out the door. And there already is some nascent spending under the 1115 waiver, chiefly for screening activity, which we'll get to in a moment. Next slide, please, John, if you wouldn't mind. So as I mentioned, there are various social care networks that have been awarded, and they are across New York State. You'll see, the various shades of blue and beige and orange, however one describes some of those colors. And essentially, for each significant geographic chunk of the state, there is a different SCN involved. In New York City, it's parsed even a little more so, where essentially there are 3. that are doing the work down where I'm speaking with you from. I will tell you, though, that across New York State, the goals of the SCNs, the social care networks, are quite similar. Again, to be that regional quarterback to see these health-related social needs activities through from concept to fruition, working closely with community-based organizations and others. And so let's get to how that actually will work, John, in the next slide. So essentially, the social care networks are going to have at their fingertips or at their disposal the ability to institute and otherwise, by working with CBOs and others, conduct standardized screenings. There's actually a goal to get every Medicaid enrollee across New York State screened. We're talking millions of individuals, roughly 7, I heard at a conference of New York, or rather of attorneys in New York City earlier this month. 7 million is obviously no small number. So there is plenty of work to go around, and each of the SCNs are going to be taking part in that. And the screenings are what I alluded to. Those are the things happening right now. And there are efforts essentially to find screeners, which we will talk about again as we continue here. The SCNs are going to have at their disposal the ability to plug in for services, with community-based providers in housing supports, in nutrition, to make transportation happen. And some folks might ask, well, doesn't transportation exist and isn't already compensated under Medicaid? The whole idea is that this is transportation that is specific in service of getting health-related social needs identified and serviced. And there's also case management, which falls under the same auspices. And this is just a high-level outline of the kinds of services that social care networks are under the waiver approved to deliver with the help of the networks that they'll be developing or already are underway in developing, better put. But know that, to John's point, there's a lot more under this hood. And if you want to dig more deeply, we can point you to resources and you're free to research on your own. But this gives you a snapshot at the high level. Next slide, please. So what you see in front of you right now are questions concerning, and really a flow, better put, concerning how the screening process will work. And so we're looking at an example around food insecurity. And the question, posed here, just to give you a sample of what that screening tool, tries to get at is, whether you've had worries about being able to pay for food in the last year, which is obviously a very scary prospect for any of us. And, if the screening response is often true, that assessment then, would indicate that someone is food insecure or otherwise, certainly eligible for supports that will help to make food more accessible for them. And so you see that then the flow suggests there's referral to services, including a home delivered meals program, and then the actual delivery of services. And so that is happening across all of the different services that are going to be picked up through the screening process. It's important to note that, in some instances, individuals will be screened and they won't have what is, remember that previous slide, a level 2 service need. They'll instead have something that is identified as a need, but it won't be something that gets paid for under the waiver. And social care networks are expected under the terms of the waiver to make warm handoffs to community-based partners, essentially through closed loop referrals, to get those folks into the kinds of services that they would benefit from. These are existing services in the community, but ones for which these individuals, might be beneficiaries of, the screening being the tool to really elevate that. And so we'll talk about that as well, because there are ways for folks who are on this call, even if they are not going to be delivering those level 2 services, also to be part of this as receivers of waiver-based referrals, et cetera. Next slide, please.
All right.
And so this is where John picks it up. And
yeah,
so John,
I'll pick. Yep, I'll pick it up. And there's a very good question in the chat right now about the executive order and the freeze at the Washington level. So Gabe and I talked about that yesterday. So I'll get through this section. And as I said, Gabe, you're the legal counsel. You can take that question, but we were talking about it. So let me get through this question and then this section, and then we'll address that concern. Social care networks. So flow of funds. How do we actually get paid for what they do? This is one of the questions in one of our previous webinars. Someone put in the chat, all in caps, all in caps. How do we get paid? So this is off the state website. This is how you're going to get paid. The funds start at the managed care organization, the MCO. They will provide each social care network a per member per month. So some of you, that might be a new acronym, PMPM, per member per month. So for each member in the social care network, there's going to be funds that flow to the social care lead entity. And then the lead entity will disperse those funds to the CBO. And you can see they mentioned what the categories are. They're the infrastructure funds, funds for screening, health-related social needs fee screening, as Gabe discussed, bonus and performance payments, and then payments for delivery services delivered. So I had to take that from the state, and I had to interpret this myself because that was a big question that people were asking. How do I get paid for what I do? So I look at this as there's really three tranches related to this. The first, as we've talked about, the screening. So the screenings are going to get done. They're being, as Gabe mentioned, they're being currently contracted right now and currently being completed right now. Community-based organizations and community providers are doing those. Those funds or those screenings are being paid for in what I would call a fee-for-service method. You do the screening, you get a set fee for doing it. Then in the middle, there's the infrastructure dollars coming out of the social care networks. And those are going to go to the community-based organizations and community providers again. But these are specific infrastructure funds. They're going to be direct dollars to build up capacity. A lot of those considerations we're going to mention in the second half of this. But that's to bring on staff. That's to purchase technology and equipment needed to do the work related to the waiver. Then also there's going to be direct dollars. Really, again, it's capacity building, but a little bit of this is to be able to participate into these type of arrangements. We got to build up data. We got to be able to provide a lot of these HRSN services. We got to be able to basically, when we get the referral, participate on the system to know when that referral comes in that we get it and we're able to close the loop on it. Compliance services and business planning as well can be out of these infrastructure funds. It's also important to note those infrastructure funds are intended to go to community-based organizations. And in one of the state slides, if you were to drill these down, they say, not just community-based organizations, but small community-based organizations. Again, there's not a definition for that, but what they're really trying to do is get this down to the ground level where the boots are on the ground to get the work that actually needs to be done. Then lastly, the last tranche of funds that are going to go out is when you provide those health-related social needs services. So when you provide the food, the nutrition, so a box of food, I often use that example. Residential, so if someone stays over for a night, and transportation as well as care management services, you'll be paid for on a fee-for-service basis related to that. Now, many of the organizations on this webinar understand what fee-for-service is. You've always been provided. We've done this per unit and Medicaid has reimbursed us or some other funder has reimbursed us. But there are a lot of community-based organizations that have functioned via a grant. They've had fee-for-service elements, or we'll give you $100,000 to do this for $10,000. Yeah, you can calculate it, but a lot of it's been grant-based, and now they're asking you to go to a fee-for-service or per unit. So some of you that have not done that before need to consider that. The other part of this is the fee for those providing those health-related social needs. They're not being set locally. They're not being set within the social care network. They're not up for negotiation. During this waiver, that price list, to my knowledge, as of today, is coming out of the Department of Health, saying it is X to provide this service. That's what it is. So I think that's an important element of it as well. So, second polling question, which aspect of the waiver do you believe will have the most significant impact on your organization? That might be a little premature as we dive into the other topics, but please take a moment and respond to that. All right. Opportunities for providers. So yes, there are a lot of opportunities. Again, we will, you'll see in the other section of this, the second part is to be, have some considerations and give some thoughts, but there certainly is opportunities. Again, if I say there's one thing to take away from this, this is, first, we know what it is. Second, if we haven't done something like this before, maybe this is the opportunity. A little bit on my soapbox is I don't know when value-based payment or any of these alternative payment methods will be the 100% or the 90th percent way, but I would like to think that we are going to really, this fee-for-service model is going to go away. And I know we've been saying it since 1980, but I think it's eventually going to go away. And really, we got to prepare our organizations for that to occur. And I'll often present a slide from the Kaiser Family Foundation, and I'll say, how many of you think this, we're going to be in value-based method, or the CMS goal is that everybody by 2030 is in at least one sort of alternative payment. And I'll often have a lot of folks say, that's not possible, that's not possible. And I'll put up a slide and say, look at the penetration of the Medicare Advantage plans throughout New York State. And I show it's at 60%. So I was like, it is actually possible, because they're practically 60% of the way there. So what I say is, you know what, it's not going to happen in 2 years. It's probably not going to happen in 5 years, but probably by 2050, when we're long gone, and well, me and Gabe are long gone, at least start thinking about this and positioning your organization to start thinking what that world 20 to 30 years down the road is, and see if this is something you like. So yes, there's opportunities to get to participate through infrastructure funding and build up that capacity. Often in the nonprofit world, I talk about, we got to diversify our revenue. We can't keep doing what we're doing. So here is an opportunity to diversify your revenue streams. Collaborate. We always talk about how we want to collaborate, but here is an opportunity to actually be part of a system, to collaborate with other organizations. Almost force yourself to have to do it, but here's an opportunity to do that. Here's an opportunity to develop your workforce. I will say, while I was sitting here, one of our clients texted me and said, yep, I'm already participating in the CPT. We got a lot of programs. This is a great opportunity to build up your workforce through the waiver. Make data-driven decisions. I know some folks have heard me present on sometimes strategy and using KPIs and scenario analysis. Here's an opportunity to dip your toe in and start making data-driven decisions, and then also enhance your service offerings. One thing, and again, I hope a key message out of this is everything you do should be mission-driven. How are you providing high-quality service and expanding those services to those that need? And here's an opportunity to do that. All right. I think Gabe covered this slide, but again, it's to reiterate, because I think it's important to understand, where do you fit and where does your organization fit within really providing residential nutrition, transportation, and case management. And I will say, I've had provider groups come to us and say, well, in Disrupt, we weren't included at all. We didn't really participate in all. And now we see everything. You think about the previous slide Gabe showed from the Department of Health, that looked like silos. What I say to everybody is, if you really sit back and think about what you do, probably you do at least one, if not multiple of these things. It might not fit neatly into that bucket of, a CBO providing a nutrition service, but do you have someone that lives at a residential that you also happen to feed? Do you also have a transportation program to get your consumers from point A to point B daily? Do you provide case management, or at least part of that? So kind of start thinking about, hey, maybe this is something we already do. And as Gabe mentioned, you might not be that direct CBO, but you might be kind of already doing it. And let's look at this as an opportunity to collaborate. And Gabe, I'm going to flip it back to you.
Terrific. And so, what we're talking about really are sort of the high level building blocks in terms of, what it is that, we're expecting from the various participants over the course of these next 25 months. And we're going to move a little bit into, additional detail now for the latter portion of this presentation. And so, one of the things that, you're going to need to be thinking about pretty early, and as John alluded to, is working with social care networks. They are the folks who are in charge in the region or regions where you do your work. And you want to, work with them to get their assessments, compare their assessments to, tools that you use as a means, for instance, of gauging your, team's familiarity with conducting assessments. You also want to make sure that, you're having more detailed conversations around, what it is that are the priorities for the social care network. Obviously, under this waiver, it's intended as a fairly, big tent. There are lots of ways that social care networks can go about providing services and needs. And one of the reasons the Department of Health, in its wisdom, issued 9 social care network awards is to see differences not only geographically, but in terms of approach. There are lots of different types of organizations that are acting as social care networks. And so, what's happening in your, let me put it this way, what's happening in one region of the state may not be exactly the same as what's happening in another. So it's worth having the conversation early and often with your social care network or networks relevant to where your service areas are. So next slide, please. And so, one of the ways that you can size up your capabilities includes an assessment of your staffing and your infrastructure. As mentioned on the last slide, you want to think about whom you serve and how you serve those individuals. You want to make sure that you're trying to, find a nexus. But at the same time, and here's where, the lawyer hat, comes on with regard to compliance. You can't get paid twice for services that you're already conducting. You've got to be able to distinguish what you would be doing for the social care networks or in service of the broader waiver goals from your existing services. So essentially, these need to not be duplicative services, but they need to be related to what you've done before, because certainly the social care networks rightfully are going to want to know that you have the competency to deliver and deliver quickly on behalf of these Medicaid constituents across the state. And so things you'll want to size up include your facilities, your vehicles and equipment, your IT capabilities. That's a very important thing. It's not just determining, hey, do we have enough cyber insurance? And then determining further that if anything were to happen, you'd rely on that insurer. It's about going deeper and really thinking about how are you going to share data? How are you going to protect data? Further discussing that theme of compliance, I just want to remind all of you that if you're participating in this program, some of you, of course, may already be familiar with Medicaid and its requirements to have robust compliance programs. There is very much an expectation that flows through the entire flow, as it were, of the service delivery here, where compliant activity is going to be expected at every point. Not only can you be able to distinguish every dollar you spend, but you also want to be able to, if later asked, tell that story in a legitimate and well-recorded way. So there are requirements that are ones that come from the New York State requirements that have existed well before the 1115 waiver that apply here. And Bond, we certainly have helped lots of organizations figure out how to start with compliance if they haven't really gotten their arms around it, or otherwise bolster what they're doing. It's going to be a really important part of your next steps here and shouldn't be overlooked. So I mention all that because it's not expressly noted on this slide, but it really can't be lost in the overall effort to get on board with this. Your administration, the last bullet down here, also really needs to understand, if you're not in a position of, leadership, but you're reporting in, let's say, you need your folks at the top to really understand, what the vision here is and how it can, as John alluded to, really further crack open the door for your organization into Medicaid payment in ways that are ostensibly going to be, differential for you. It's going to be a chance to get involved in getting paid for services that historically the Medicaid program has not recognized. So your administrative leads need to understand that, and they can be helpful in perpetuating this, making sure you have the resources, et cetera. Next slide. So let's get a little bit more nuanced in terms of that payment that I was just mentioning. The first period of this work, which is going to be governed by the waiver, and by this work I mean efforts around health-related and social needs, or health-related social needs. What the structure of the waiver essentially permits is that CBOs, community-based organizations, and others similarly situated that are receiving funds from the social care network, which are the social care networks themselves are distributing based on their receipt of them from higher up in the chain. All those CBOs and others who are doing things like screenings, providing housing supports, or otherwise addressing food insecurity, as John mentioned, that's going to be fee for service. That's going to be the way it goes for the duration of this period of 2 years and a month or so that we've got. After that, it is the intention of New York State, ultimately, and this is the Department of Health and others in leadership realms, to take what we've learned from these models and demonstrated activities and use these as tools to, over time, may not be all at once, but certainly it'll be an intended effort to figure out how to fold health-related social need care into bundles, into other forms of capitated payments, so that partners working together, including CBOs, including hospitals and health systems, including many others who are already in the Medicaid payer environment, they can come together in partnership to drive costs down and improve the quality of care. Thinking back about that, triple aim that Dr. Berwick, was so passionate about as we were moving into the Affordable Care Act's debate. The principles are not so different here. Next slide, please. So one of the things that you can take away from our presentation with any luck is that the pieces of how you evaluate your success are intrinsically interconnected. And in order to set yourself up for success, you need to be doing something akin to walking and chewing gum. You have to be thinking about a bunch of things at once. You have to be ensuring that your data capacity, if you identify it as in any respect less than it should be, you've got to invest in building it up. You may be able to work with your social care network on that. Per John's point, there may be monies available for that. You need to think about your financial and performance measures. You're going to need to make sure that throughout the work of implementing programs and operations here, that you are determining, can you not only break even, but is this going to be, in the end, financially feasible for you to do as organizations? The calculus will not be the same for every one of you. Certainly, John and team can help, and we have some aptitude in that as well. But you've got to think upstream. You've got to think early about, do we have the tools to make this work? Knowing what the compensation will be for the services, every SCN has essentially a table of costs that are circulating to the various providers with whom these SCNs are working, in order to tell you what it is that you'll get paid for each of the services. They vary a bit from geography to geography, but they're pretty much set. And you've got to think about that math quite intentionally. I alluded to the regulatory concerns. I mentioned compliance. You've got to also think about cybersecurity. For some organizations, if you've never, in a very intentional way or even in a passing way, executed a business associate agreement or otherwise thought about how you handle PHI, you've got to really change your emphasis from something that may have been more passive to something that's very intentional and active. You may get some help from your SCN and how you do that, but the SCN on the other side of that coin is going to very much expect that you either have some understanding and elevation of the importance of this, or that you're going to work very quickly to get there. And then in terms of performance, it's connected at some level to the financial tab at the top right there, which also touches on performance. You've got to get down and fairly granular in terms of what it is you intend to deliver over the course of the 2+ years. Is it just screenings? Is it work around food insecurity? Is it work around housing? Who from your team's going to do it? What are the elements of your current portfolio you're going to lead on to get this done? Who might you need to hire? Who needs to be trained? These are just some of the examples of how it's going to need to happen. And you need to be thinking about that in a very intentional way right now. And part of the reason I mention that is because we are at this moment in January of 25, about to flip the calendar next month, or later, as we close out this week into next month. And I mention that because money has already started to flow. Yes, in an earnest and sort of early way, but it already is the case that monies are being spent under this waiver. And so if you want to get in, the time is now to really start rolling up your sleeves if you haven't already. Next slide, please. So that brings us to our third polling question. And let me read it out to all of you. Is your organization currently equipped to meet the capacity and infrastructure demands of the 1115 waiver? There are 3 choices: yes, maybe, and not. And you should pick the letter that's most applicable to you. And let me turn this back to John. And I thank all of you for listening to what I've had to share. John, the floor is
Actually,
yours.
yeah, Gabe, I was gonna dig more into those strategic considerations that we had on the puzzle, but I do want to address the question in the chat about the executive order that was issued yesterday, but then we saw it rescinded or sorry, 2 days ago, then we saw it rescinded yesterday. I know before that you and I were talking about that. How could that impact this waiver? And I think it's important for this group to hear kind of what your views are and a little bit of what my views are, is how could this waiver be impacted by that executive order or other executive orders?
Sure, and I'm happy to address that. And let me tell all of you, the answers won't be entirely satisfying because we're still working through it all, as most people around the country are. But there's some basic things to think about. The first is that the waiver amendment functions as a contract, depending on who is assessing, how it fits relative to a grant or another type of payment modality. And I have seen communications involving the New York State Department of Health that suggested it is the state's view that these monies are contracted for and thus outside of the auspices of the executive order, which yes was rescinded, but yes we also heard that parts of it may still be enforceable despite that. And that swirl of activity continues today as we speak here. There are, of course, other reasons to appreciate that Medicaid dollars have been at least affected in the course of this week. New York was among almost 24 states that saw their Medicaid systems essentially frozen earlier this week. That freeze has been released and the Medicaid system is back online here in New York. But that was part of the implementation of that broad-based EO. All of that is to say, when the dust settles, and I'm speaking from a place of uncertainty, like most others in this moment, I have a strong hunch, if not a solid belief, that the waiver monies, because they are contracted for, are going not to be affected by any of the activity that is currently affecting the review of grants. We're also seeing that even that broad-based order is being pulled back, in key regard, being reworked, and I think wherever the administration ultimately settles, following the various legal reviews underway, will be somewhat narrower than what we saw in the initial pass. And so, of course, we're tracking this closely because it matters so much to all of you and to the success of this set of program initiatives in New York State. One last element that I'll raise is that in New York State, we have a history of seeing waivered funds, switch, ultimately the oversight of which switch, from one party to the other. And the funds themselves were not disrupted. I'm alluding specifically to DSRIP. DSRIP ran through 2020. What ended up happening is that the Trump administration chose not to renew those funds, which is very much a possibility here come 2027 with the current iteration of the waiver. We won't know that though for some time. And it's best for us just to continue to review the information coming in. And as pledged, we will absolutely keep all of you apprised because it matters so much. And we encourage you to keep on pressing forward here on the assumption that there is a green light, because it is, I think, a very fair assumption that these monies will remain intact at least through March of 27.
And I will say too, when I first saw it in the chat, someone put the freeze was rescinded yesterday, February 29th. I just took it as funny as February 29th, 2025 is not actually a day. I know the person clarified January, but I just thought that was a little bit funny. So if someone saw me laugh, like, yeah, everything happened on February 29th, the day that doesn't exist. Or much like they'll say, you'll get that free money tomorrow because tomorrow never really comes. Back to our regularly scheduled program. So Gabe touched on regulatory. So with this, you do need to be thinking about your regulatory environment, especially for those that have not, as Gabe said, or have not participated really in a Medicaid environment before. you need to think about those regulations. Also, a lot of this is currently evolving. There's been compliance programs for a while, but when we think about secure data, privacy, and cybersecurity, that is something that is always evolving. That is something with one day we think we have the patch, the next day the bad guys figure out a different way to hack. What I'll say from this is, I'm of the belief, from speaking with a few from social care networks, is that really when the systems come down, the referral systems, that those systems are going to meet cybersecurity standards. They're also going to help you meet the compliance standards as well. I would sit there and how I would look at it too is, especially if I was in your position, or if I was on your board's position, to say, that's great. I want to trust but verify that. I want to know for myself, if I'm inviting somebody into my system, is that going to be secure? So we do have to think about the cybersecurity aspect related to that, as well as any good compliance program has monitoring and reporting. Again, a lot on this webinar today have that. I can see the names, but think about, what do you have as it relates to the waiver, or think about if you don't have any of this at all. Do you need to build up that capacity, and how can you leverage the social care network to help you build up that capacity? And I think Gabe made a really strong point too, is also to make sure you're not getting paid twice, making sure you have a strong compliance program that's not paying you for the same level of effort once from out of the waiver, second out of your traditional funding model too. So make sure you have those compliance programs in place to address it. I've started mentioning cybersecurities. This is a little bit out of the operations manual, which I do know gets updated frequently, but it is saying, okay, what type of cybersecurity do you need as a community-based organization to participate? And again, we can read it here on what they say you'll need and how they categorize you. I think the takeaway here, again, I'm not a cybersecurity expert, but the takeaway here is you will have to do something. If you don't already have cybersecurity protocols in place, you will have to be doing something to ensure the information that's coming through the exchanges and these connections and the referral platforms is going to be secure. And a lot of folks will say, okay, I get it, but really, where are you getting? And often I'll say, how many people remember the Target breach? What the Target breach wasn't that Target system failed. It was their HVAC vendor had a way into their system, and that hacker went all the way through the HVAC and got to the point of sale terminals. So yes, I'm not saying we're going to have this big breach, but that's why when you think about you're connecting, whether it's to a lead entity or another CBO that you're going to collaborate with, you do want to make sure you're safe and secure, and that you have ultimately what you believe is your organization protection. There's a little bit more too on cybersecurity. These will be sent out, but you can read, and you can then read about what the good ones are. Want to cover data and analytics. Again, some organizations that have dipped their toe, or more than dipped their toe in the water with Disrupt, completely understand data analytics. Those that are already in value-based payments, they understand the importance of this. But some others that haven't maybe gotten that far need to understand, in order for you to be successful, your social care network to be successful, and ultimately your community to be successful, you do need to have data and analytics. And some of you, I will say, are well along this journey, is understanding what it is, and some of you are maybe not so far along. I will say, from my understanding, the social care network again will be helping you related to some of these data and these analytics as well. But it's really upon you to also, they can provide you the tools, but it's really on you to understand what they are, understand what they mean, be able to interpret them, and use that for change. So we kind of walk through really any good set of data analytics. You got your KPIs. You set your KPIs. It's manageable. Where should we be? Where should we be getting to? Then you want to implement. You want to be able to track it. Are we going up, down? And if so, is that good or bad? And how does that relate to what we're trying to accomplish? Obviously, continuous improvement. We're not measuring something just to measure it. We want to improve. And then lastly, report on ROI. It's not just, that sounds like a very consultant or a technical term, report on ROI. Often what I tell the nonprofit organizations I work with, a lot of what you do is tell your story. But now what we got to be able to do to tell our story and say, it isn't that we just helped John today with shelter. Tell the full story of, these are all the outcomes that are occurring. This is why we provide high quality services. This is why maybe down the road, if something truly becomes a fee for service, that you can say, maybe I should get a little bit more because I do a little more on quality, and ultimately that will benefit someone. So it's using data and analytics really ultimately to tell your story. Cost drivers. So Gabe touched a little bit on the financial piece, and I've seen a lot of improvements, especially in the post-COVID world over the last 5 years, in getting better analysis on the financial statements. But I do recognize we're nonprofit organizations and what our sizes are. We don't have the ability to implement a full cost accounting system or do activity-based costing, but we do have principles related to cost accounting, and we really should start to understand that, especially as we move to some of these services where some of you have always provided the fee for service, but some other you have not really provided that fee for service. When I mentioned earlier, is to start understanding what the cost per unit really is. Last week, I kind of threw out there and said, hey, in a residential house, if you got paid $100, would you make a profit or not make a profit? And I kind of threw it out there. And this group of providers sat around and they actually started trying to do the math. And they said, geez, at $100 a night, and you could see them going through their head of all the costs and all the cost drivers, would we make money? And I threw out an example, and it actually came about a 10-minute exercise. Those are the types of exercises we need to do in this new world, in this new world, to understand what our costs are, understand where our costs lie. I say enhanced cost accounting. Again, think where we are, think what the information is. A lot of you file CFRs or some other source of cost report. That is actually a basis to maybe start some of your cost accounting. Everyone says, when you do these models, where do you start? Every provider, no matter what, in the nonprofit industry, I always try to start at the cost report. So that's one way we can do it. Benchmarking, understanding where others around you are, with like circumstances, rural, urban, what area of the state, but benchmark just to know. Don't always say this is where we got to be, but just to know where you and your peers are and say, are our costs in line? Obviously, regularly review it, set those metrics, look at it. If you're high in some areas, look at technology. Where can we automate? Where are we redundant? Where can we improve our workflows to provide better quality at lower cost? And then lastly, collaborate whether it's amongst your peer organizations outside or even amongst your teams. And then the last polling question we have is, what do you see some of the biggest challenges for your organizations in aligning with the waiver goals? Pause. All right.
John, I know we have about 7 minutes left, so
yep.
We should just make sure we get to the polling questions.
I got a couple more slides, and if folks want to put some stuff in the chat, but really everything we've talked about today, whether it's this waiver, whether it's converting to an alternative payment model, whether a social care network, it's whether you're providing those services, you're providing screening services, or you're building capacity. What I always say is, bring this back to the mission. What is your mission to exist? And really consider is how much time and effort and capacity you should be devoting to this, or you should be devoting to your mission. So that's where that mission assessment comes in. Does this match our mission? Does this match our mission today? Or will it match our mission in 10 years, 15 or 20 years? So always bring it back to your mission and say, what can we participate? Gabe had the slide about, look at what the local needs are within your community. So say, this is what our mission is. These are what the waiver initiatives. How do we participate in this? How do we make a community impact by participating in this waiver? And then what is the long-term strategy? We talked about a little bit of those, all the opportunities with this waiver has that you can get, help build up your capacity. But how does that match up to your long-term strategy as well? And as long as we're doing it all on mission focused. And then with that, so that there, Gabe, we got about 5 minutes left to see if Gabe, if you have final thoughts and if there's also any questions in the chat.
What I'll say is that we recognize that none of this is easy. Yes, we do thank you for attending, certainly, but we also want to be here to guide you, help you think this all through. We've been working, each of our organizations respectively, and each of us personally, with folks really all around the state, and a lot of the issues are quite similar in scope and broad form, but each is unique to your organization or to your delivery model. And so it's really important, as John was mentioning throughout his commentary, to take that deep and analytical look at what you're doing now and how you might do it down the road in a variety of different ways. And so for those who haven't done it in particular, it may not be intuitive, and that's why we wanted to make sure you had some information with which to work starting today, and certainly we're resources if you need more. It looks like in the chat there isn't anything new that has come through. John, is there anything from those polling questions that you think reveal trends that would be worth talking about?
Let me, Shannon, are you able to share those in the chat, or if I log in, can I see those?
Yes, I can share them.
All right. Yeah, let's put those in the chat while we got 4 minutes.
Thank you.
Thank you for doing that.
I expect they're going to reveal, some of the trends that we were seeing, which, here, for instance, we know that folks are somewhat familiar with a majority of 57% with the 1115 waiver before today. We're hoping that you left this program that much more familiar. And there are mixed results in kind of the best sense in terms of various ways in which you think you could contribute, about a quarter each for workforce development infrastructure funding, alternative payment models, and data and analytics. And then the third of 4 items here, there is a very strong pull to almost 70% of you that say you're somewhat prepared but need additional resources in order to make the 1115 waiver work and contribute to it. So we understand, to the point I was making a moment ago, that this is the first time you're doing this. The state is itself doing this for the first time, and so as a consequence, there is a lot of learning that's happening simultaneously. And your social care networks, I should reiterate, and I know we've got a couple of them on the line here, they are very much committed to making sure you have the tools and the skills, let alone the understanding of your responsibilities to do the work well. That is part of each of their missions, and we want to encourage you to be in close and regular contact with them. Where we're mentioning support that our respective organizations can provide, it's in doing the work in between. It's the building and bolstering the compliance program. It is the assessment of your cyber capacity and potential gaps, et cetera, et cetera. And so we want you to be working with your social care networks, and they very much want the same. But just know that we're here to be complementary. And one of the things that really jumps off the page in the last poll is this challenge around staffing. There is clearly a majority of you that say we're not sure how we're going to staff this work up, and we encourage you to think about the modeling for it right now and determine what it would take to hire more folks to do the work. John, let me turn it over to you.
Yeah, and I would say with the staffing too, is we focus a lot on the social care networks today, but there, as I mentioned in the beginning, there is the career pathways training program. That's also something you should start to educate yourself on, and how those are being administered at the workforce investment organizations as well. Because as I said in the beginning, ultimately we can talk about all we want to accomplish with the social care networks, but we need folks to do the work and to do the work at the ground level. So, you really got to run on parallel paths, as Gabe said, especially as I think the number is 55% is concerned about the staffing. So just as important in, building up the data capacity is building up the staffing capacity. Otherwise, there's no really need to build up the data capacity. And I think too, in the last minute is our travels around the state, what we're hearing, the questions we get, and we wanted to really try to be addressing those and give the ground level of this is what the waiver is and this is what you need to be thinking about. But if you have questions, feel free to reach out to us. And I will always also say, if you have questions on something very specific or how do I participate, again, your social care network, your leads, you'll look at the slide that we had here, the 9 in the state, reach out to them. Their websites are built and they have the ability to contact them and ask them questions too on how you can participate and what it looks like as well. So with that, it is 3 o'clock. So we really appreciate everyone's time and thank you very much.
Thank you.
Bye-bye.